So I break that down into a number of areas. One is schools, which obviously is of great concern to teachers and parents. The other one is in the street and other public thoroughfares. And then finally, obviously, we tend to use PPE from a protective point of view in hospitals. I won't cover that because that's well covered elsewhere. So teachers, I've explained to teachers that there's an awful lot of evidence to indicate that children do very well with infection. I'm not saying everyone will be absolutely okay, but nearly all children do very well with infection, and you could almost regard them as super spreaders. So obviously teachers are concerned, am I going to get this virus? And I think the honest truth is you probably are going to get the virus. That in itself is nothing to particularly worry about. For the vast majority of people, is not a serious disease. Over 90% of people are not even, 80% of people don't even know they've got the virus. So the first thing is, what does a mask do and how long will it be effective? As a PPE instrument, it is not very effective because it stops working after 15 minutes, and the latest research suggests that the virus stays on your mask for 9 hours. So if you don't take it off appropriately, you'll get yourself contaminated. Your best protection is washing your hands frequently and often. Wearing plastic aprons makes no sense. Wearing gloves just means you don't wash your hands, you touch surfaces, you touch your face, you get infected. So the most important thing, I think, is take sensible precautions, wash your hands frequently, don't be frightened, and generally love children because they are a blessing to the world. And the PPE, let not fear control what you wish to do and why you went into teaching, which is to look after children and give them an education.
Okay, what about in respect of people who might be concerned that in going shopping, for example, they might spread, they might themselves be asymptomatic, not coughing or sneezing, but actually be COVID positive, and they think that maybe wearing the mask might limit the chances of them spreading the disease?
What a great way of declaring to everyone you might be COVID positive and creating a sphere of avoidance around you. I don't think that works particularly well. I think the other thing to remember is that sunlight itself is a fantastic disinfectant, and that actually washing your hands and making sure that you always wash your hands frequently and often is the safest way. Certainly there's a little bit of defence that you can provide if you're coughing and spitting or spluttering and sneezing. A mask might stop it, and that's why we've introduced it into Mount Alvernia to stop the spread of the virus.
If that's the case, you should be self-isolating.
Well, so there's a lot of strict observation of symptoms, that people have to declare the symptoms, that observe for temperature. We're taking a very precautionary approach because that's a very vulnerable population. But in addition to which, in fact, we found when nurses were wearing masks that people with dementia were getting quite fearful. They didn't understand. In fact, they now wear face visors as a way of stopping that spread. We're being sensible. We know that the biggest risk is for people over the age of 70. Often these very vulnerable people have other conditions, and we've done whatever is possible to make that a good way to limit the risk. So I don't necessarily think that people walking in the streets need to wear masks. I don't think it adds anything. Certainly in big countries where they're trying to stop the spread, where they're trying to lock down cities, we just don't have that option. And the way I see the way people use masks, they're actually showing a lot of their own internal anxiety and fear when they wear the mask. Wash your hands. It's a lot easier. Stop the cigarettes. It's probably more harmful. And don't let it rule your life.